Pregnancy is, well, it's a massive journey, and it brings about some incredible physical changes to the body. So how can we best support ourselves through that whole process? Well, today, we're going to demystify the absolutely essential role that physiotherapy plays in antenatal care. Let's really dig into how it helps create a healthier, stronger journey for both mom and baby.
So here's what we've got on tap. We're going to start by taking a quick look back at the history of antenatal care, and then we'll meet the modern-day team. From there, we'll zoom right in on the physio's role, covering everything from dealing with those common aches and pains all the way to getting your body ready for labor.
All right, first things first, what are we even talking about when we say antenatal care? It's actually pretty simple. It's all the care a woman gets from conception all the way through her pregnancy. And the number one goal? A healthy mom and a healthy baby. That's it.
But this level of comprehensive care hasn't always been a thing. It's actually pretty amazing to see how far we've come. Let's take a quick trip back in time to see how we got here. So the whole idea of prenatal care really started taking shape around the turn of the 20th century. By the 1920s, people were starting to recognize that pregnancy came with its own unique challenges. But the real game changer, that came in the 1930s, when a pioneer named Vaughan started the first ever antenatal exercise classes. His whole idea was that flexible hips and a flexible spine would make labor easier. Makes sense, right? And then, by the 50s, that idea blossomed into Keep Fit classes, with relaxation and breathing skills, and that's really where physiotherapy started to become a part of the picture.
Okay, let's fast forward to today. Modern antenatal care is so different. It's not just about one doctor anymore. It's a whole team, a whole circle of support. And this really shows you what that team can look like. You've got your obstetricians, your midwives, dietitians, all working together. But the specialist we're really honing in on today, right there in the middle, is the physiotherapist. And believe me, they are such a vital part of this support circle.
So what exactly does a physio do during pregnancy? I can tell you right now, it is a whole lot more than just handing you a list of stretches to do.
A physio's job is just so comprehensive. I mean, look at this. They're there to prevent and treat all those aches and pains that come with a changing body. They give you super practical advice on your posture, they help you stay fit, they teach you how to relax, which is huge, and they actively get your body ready for the marathon that is labor. Okay, now let's get into the nitty-gritty. We're going to look at some of the most common physical issues that pop up during pregnancy and see how a physio can offer real, hands-on solutions.
First up, we have a big one, sacroiliac joint dysfunction, or SI joint pain. This is that really nagging pain you can get around the back of your pelvis. It's super common because pregnancy hormones are busy loosening up all your ligaments.
So what can a physio do? Well, they can teach you specific little movements, like these gentle pelvic tilts you see here, that can help get that joint back in line and ease the pain. They might also suggest a support belt to give you a little extra stability. And honestly, these simple things can make a world of difference.
Okay, another really common one is symphysis pubis dysfunction, or SPD. This causes pain right at the very front of your pelvis. If you've ever felt a sharp pain when walking or trying to stand on one leg, this might be why. It can be so uncomfortable.
And a management for this is all about practical, everyday advice. A physio will coach you on small changes, like instead of standing on one leg to put on pants, sit down. When you get out of the car, swing both legs out together. Take smaller steps when you walk. Little things that have a huge impact. Gentle exercises and those support belts are also a key part of the plan.
Now, it's not all about your back and pelvis. All that extra fluid you're carrying around during pregnancy can lead to nerve issues too. You've probably heard of carpal tunnel syndrome, that numbness, tingling, and pain you can get in your hands. Yeah, that can happen. The good news is the ways to manage it are often really simple and effective. A physio might recommend things like using ice packs, propping your hands up on pillows when you rest, and wearing a splint, especially at night, to keep your wrists straight and take the pressure off that nerve.
But hey, it's not just about managing pain, right? It's not just damage control. Physiotherapy is also super proactive. It's about getting your body strong and ready for one of the most physically intense events of your life, childbirth.
And it all starts with the basics, like posture. As a baby grows, your whole center of gravity shifts, and it's so easy to start slouching, which puts a ton of strain on your back. A physio can teach you how to sit tall, with your spine supported, which not only feels better, but also helps get your pelvis in the best possible position for labor.
And that idea extends to another crucial skill, ergonomics.
Learning how to lift properly, and that means bending with your knees and using your powerful leg muscles instead of your back, is absolutely essential for preventing injuries, especially if you already have other little ones to lift.
This practical education even covers everyday safety. For example, do you know the right way to wear a seatbelt when you're pregnant? Take a look here. The lap belt has to go below your bump, sitting across your hips, never over the top. It's such a simple adjustment, but it is so important for protecting both of you if you have to stop suddenly. Physiotherapists also empower women by teaching them about active birthing positions. You know, things like kneeling, leaning forward over a birthing ball or a chair, or getting on all fours. These positions can help you use gravity to your advantage, manage pain, and maybe even help labor progress more smoothly.
Now, when it comes to pain relief during labor, there are kind of two toolkits. You've got your medical options like epidurals, but physiotherapy really focuses on filling up that non-medical toolkit. It's about empowering women with techniques they can control, like breathing patterns, relaxation, massage, or using a TENS machine, giving them more options to actively manage their own experience.
So, when you look at the whole picture, from its value in the first trimester all the way through preparing for birth, it leaves us with a really important question. How can we make sure that physiotherapy is a standard part of every pregnancy journey to improve health for everyone?